We didn't just support the revolutionaries. We were the revolutionaries when these 5 physicians risked everything, their practices, their livelihood, their history, and even their lives. They could have been hung by the British king. We were the revolutionaries. And the legacy of Dr. Benjamin Rush and other colleague physicians who signed the Declaration of Independence that demands that we do more, that we stand up to survive injustice, that we confront it. We are the descendants of the Rush, the Wilcots, the Bartlett. We are their descendants as physicians. And we are here to reclaim the voice of physicians in public square. Welcome to our introductory episode of Unmuted, the Diaries of the Virtual Psychiatrist. I'm your host, Dr. Muhammad Aly Rifai, and I'm a professor of medicine and psychiatry. During this series of podcasts, I'm going to be taking you through a journey, the journey of the history of psychiatry, a journey of my history and my contribution to the field of psychiatry. And during this journey, we're going to talk about the development of the field of psychiatry from my homeland, from Aleppo, Syria, to Philadelphia, Pennsylvania, and to Easton, Pennsylvania, where I practice at Blue Mountain Psychiatry. I'm going to be talking to you about the developments in psychiatry and how I started one of the first telemedicine, telepsychiatry program in the country. I'm hoping to tell you interesting stories that will draw a lot of lessons for our listeners about how the field of medicine and psychiatry have gone through changes throughout the years, and how us as physicians have been contributors to the field of medicine throughout the years. I also hope to tell you about my trials and tribulations and how I was affected throughout my career. My story starts in Aleppo, Syria. That's where my family is from, is in the northern part of Syria. Aleppo is one of the oldest continuously inhabited cities in history. In Aleppo, in the year 1400s after Christ, one of the first psychiatric hospitals in the world was built, the Bimaristan al-Aragoni. That's where I come from. I grew up visiting this inpatient psychiatric hospital that was built as a retreat for individuals who were experiencing psychiatric problems. This hospital continued for many years, up to 450 years, until it became a museum about 50 years ago. That's where I come. They used to house patients who were experiencing psychiatric problems that were unknown at that time, but were thought to be diseases of the soul and the spirit. These individuals rested there. They received no medications, but they received care by the physicians who were there. And sometimes they received nutritional support, and sometimes they were secluded in restraints. But they had no treatments for these patients. This is where I come from. This is where I grew up. I used to visit that hospital when I was in high school, and I always dreamt about being a psychiatrist. I hope during this episode and future episodes to tell you where we've come from in terms of understanding the diseases of the mind, the diseases of the soul, and how there is an effect of the divine in terms of our ability to function, in terms of our beliefs, and in terms of our ability to fight diseases. Following my high school experience, I started my medical school, and I've always knew that I loved the field of psychiatry. During my medical school, I was lucky that I participated in clinical research as well as basic science research trying to understand the effect of neurotransmitters on different cells. That research I completed at the University of Tennessee in Memphis. And following that, I entered residency in internal medicine and psychiatry at the University of Virginia, a unique residency that enabled me to understand both the fields of medicine and the field of psychiatry. Now, people think that physicians have no effect on the community and society, but I live in Easton, Pennsylvania, and this is the year 2025. Next year, this country, the United States, is going to celebrate the 205th year since independence. In Easton, Pennsylvania, on July 8th, 1776, the Declaration of Independence was read aloud. A lot of people don't know that the Declaration of Independence of the United States was actually signed by 5 physicians. The father of American psychiatry, Dr. Benjamin Rush, was one of the signatories of the Declaration of Independence. Other physicians, Dr. Josiah Bartlett, Dr. Lyman Hall, Dr. Matthew Thornton, and Dr. Oliver Wilcott signed the Declaration of Independence. Now, these doctors were not just bystanders in history, they were authors. They didn't sign it from the safety hindsight. They signed it knowing that they were placing their lives, their liberty, and their legacy on the line. They signed the Declaration of Independence, 5 physicians declaring that this country, the United States, is independent. They also knew that they were at risk of their life being taken by the king. They could have been hung by the king for signing the Declaration of Independence, but they were physicians. They were the pillars of this society. Going back to Syria, the Bimaristan al-Argoni, the psychiatric hospital, brought to this world an understanding that psychiatric illness is a unique type of illness that affects the brain and the mind. It was that work that Dr. Benjamin Rush, the father of American psychiatry, built on. And he actually, one of the first book about the diseases of the mind. He also established the American Journal of Psychiatry, which was the first journal that talked about psychiatric illness. Now, Dr. Benjamin Rush, who is the father of American psychiatry, had read some of the work of those physicians, some of the work of those psychiatrists who started the Bimaristan al-Argoni in Aleppo, Syria. Such a beautiful journey, from one of the oldest continuously inhabited cities in the world to Philadelphia, Pennsylvania. Physicians signed the Declaration of Independence. They signed that parchment of paper. They signed the Independence Manifesto. Dr. Benjamin Rush was not just the signer of the Declaration of Independence. He actually led the Pennsylvania delegation to and ratify the Constitution of the United States. It is very interesting that interlay between how physicians who are members of the community, how they birthed this nation, how they contributed to the establishment of both the Declaration of Independence and the Constitution. It is that contribution from Dr. Benjamin Rush that propelled me to be interested in the fields of medicine and psychiatry. During my training, I was very active in research. I did research in internal medicine and psychiatry and traveled after my residency training to the National Institute of Mental Health in Bethesda, Maryland, where I witnessed a lot of cutting-edge treatment modalities. I worked on transcranial magnetic stimulation, which is a novel treatment to treat depression and anxiety. It's a non-medication treatment. And during this podcast, In next episodes, we're going to talk about transcranial magnetic stimulation and how it is a cutting edge and a novel treatment for individuals with a multitude of psychiatric illness. During my time at the National Institute of Mental Health, I also worked on a cutting edge treatment for depression and anxiety. This medication treatment is called ketamine, which is an anesthetic, which later on I utilized effectively to help individuals with depression, anxiety, and post-traumatic stress disorder. Physicians have always been pillars in terms of their contribution to society and their community. Why does this matter? Why does this history matter? Because this history isn't just academic. It is urgent. It is personal. It's the bloodline of our profession. We physicians were not merely the caretaker of this republic, of the United States. We were its founders. We didn't just support the revolutionaries. We were the revolutionaries when these 5 physicians risked everything, their practices, their livelihood, their history, and even their lives. They could have been hung by the British king. We were the revolutionaries. And the legacy of Dr. Benjamin Rush and other colleague physicians who signed the Declaration of Independence that demands that we do more, that we stand up to survive injustice, that we confront it. We are the descendants of the Rush, the Wilcots, the Bartlett. We are their descendants as physicians. And we are here to reclaim the voice of physicians in public square. We are physicians who are leaders of this community. I'm going to tell you also about my involvement in legal cases. I'm going to bring you stories about how I worked through some of these legal cases and interesting legal experiences. We, as physicians, and I talking to my fellow physicians, I'm talking to my fellow patients, I'm talking to my fellow human citizens here in the United States. Dr. Benjamin Rush, one of the signers of the Declaration of Independence and one of the founders of the field of psychiatry, believed that the health of individuals is part of the health of the Republic and that these things were inseparable. If he were to be alive today, he would have been horrified at the treatments of physicians. He would have been horrified at the state of our health system because wanted a system of medicine that tended to fellow citizens. We are descendants of these physicians, and we should not despair. We should not despair. We should organize. We should continue to write. And this is why I'm doing this podcast, because these are the diaries of the virtual psychiatrist. My listeners are going to be hearing interesting stories about discoveries in the field of medicine and psychiatry. I started the first telehealth emergency psychiatry system in the nation, in the Lehigh Valley, Pennsylvania, where Easton is one of the towns in the area. Easton, where it is one of 3 cities where the Declaration of Independence was read on July 8th, 1776. It was read in Philadelphia in the public square. It was read in Trenton, New Jersey. And it was read in the public square in Easton, Pennsylvania. A bugler came out and read the Declaration of Independence. He blew the horn. Hear ye, come and hear the Declaration of Independence. 1776, July 8th. My office continues to be in Easton, Pennsylvania. I'm coming to you in 2025, almost 250 years later. I learned that my office, which I started in 2013, was actually inhabited by one of the Rushes, a descendant of Dr. Benjamin Rush. What a coincidence, because Dr. Benjamin Rush is the ancestor of the people who occupied my office before I opened it in 2015. It used to be a doctor's office. It used to be a cardiologist's office. It used to be a pediatrician's office. But one of Dr. Benjamin Rush's descendants occupied my office. And so I continue his legacy, ratifying the Constitution, bringing these stories to my fellow physicians. We're also going to talk about new treatments in medicine that came about. Dr. Benjamin Rush didn't have a lot of tools to help start and excel the field of psychiatry, but he was one of the first physicians to articulate that psychiatric illness is part of diseases of the mind. They didn't have medications, so they had some potions that they hoped that would calm people. He did recommend a treatment called the centrifugal chair that he thought would bring in more blood flow to the brain. Imagine these things. We find out 150 years later that transcranial magnetic stimulation, exposing the brain to magnetic field, would actually propel the blood to the brain and would cause more blood to the brain. We are doing it with magnetic waves, magnetic fields to the brain, and Dr. Benjamin Rush tried to use centrifugal force to cause more blood flow to the brain. Dr. Benjamin Rush also suggested a tranquilizer chair as a treatment modality for individuals with psychiatric illness. We now have a chair that individuals sit on, and they have a helmet that exposes their brain to a magnetic field, and the treatment we call transcranial magnetic stimulation. And I'm going to tell you about my journey with that treatment, new discoveries, novel treatment modalities with transcranial magnetic stimulation. Dr. Benjamin Rush also thought that bloodletting would be a treatment for individuals with psychiatric illness. It is very interesting, the journey of Dr. Benjamin Rush. He went through a pandemic. They had the yellow fever pandemic in Philadelphia, Pennsylvania, between 1778 and almost 1800. There were episodes of pandemic in Philadelphia, Pennsylvania, and he thought bloodletting was the treatment. He was wrong. A lot of other physicians criticized him, but he didn't despair. He continued to offer treatments to his fellow citizens for whatever he thought. We now know, for example, that the COVID pandemic, that there were some treatments that were proposed that were criticized by other physicians, but we persisted. We offered the best treatment that we think is appropriate to our fellow citizens. That's what Dr. Benjamin Rush proposed. I'm trying to draw parallels from Dr. Benjamin Rush, the first psychiatrist, the father of American psychiatry, who was buried in the Christ Church burial ground in Philadelphia, Pennsylvania. As a physician, he was a professor at the University of Pennsylvania. He was the physician general for the Continental Army of the United States and the father of American psychiatry. In fact, his silhouette is on the emblem of the American Psychiatric Association. And he's always been the leader of psychiatry. I'm also going to tell you stories about interactions with patients, things that would bring humanity to the field of medicine and the field of psychiatry, because we have traveled far and far away during this world and things that we have gone through. I'm bringing you my story because I want hope to the new generation of physicians. I'm also going to tell you stories about how I was on the wrong end of the law, how I was prosecuted, and how I prevailed during this prosecution. Similarly to Dr. Benjamin Rush, who was ostracized by his colleagues because of his treatment. He was almost prosecuted, but he prevailed, and his legacy continues to this day. So I'm hoping that I can tell some of these stories to bring maybe a renaissance of physician activism. We need more Rushes. We need more Bartletts. We need more Halls. We need a profession that knows its history and fights for its future. And this is why I'm doing these Diaries of the Virtual Psychiatrist. Your host, Dr. Mohammed Aly Rifai. I'm bringing you my experience in medicine, my experience in psychiatry, my training in addiction medicine. Physicians are not broken. We are burdened by this new healthcare system. We are sidelined, we are ostracized, and we are muted. And that's why I titled my podcast, Unmuted. But we are like our revolutionary forebears. We must cast off what chains us, the restraints from the healthcare systems that restrain our independence, our spirit of innovation and practice of medicine. Let the white coats once again be a symbol, not only of clinical competence, but also of constitutional courage. Part of the Constitution is freedom for our patients to pursue treatments. Let the exam rooms once again be sanctuaries of freedom, not of surveillance sites for state intrusion into our practice of medicine. Unmuted. Let our words, our writings, our presence in medical offices, in exam rooms, but also our presence in courtrooms and in legislative hallways remind our country we were there at the beginning. Doctors were there at the beginning of this country, and we will be at the rebirth. I'm hoping that I can bring you stories about how the field of medicine and psychiatry have been revolutionized. Genomics. I've been an active participant in genomic studies for a long time. I'm also going to bring you stories about artificial intelligence and its involvement in the practice of medicine and psychiatry. I've started Psychiatrist, which is a podcast, the first AI-assisted podcast by a psychiatrist. I'm going to bring you funny stories about how AI has been involved in the field of medicine and the field of psychiatry. I'm going to bring you stories about how we are plotting the future of medicine and psychiatry with novel medications, novel genomics, the involvement of AI, new treatment modalities. I'm going to also talk to you about this new treatment modality that we're bringing in to our patients using artificial intelligence and biofeedback to help the improvement of patients' depression, anxiety, attention deficit disorder, bipolar disorder. This podcast is to my colleagues who may be afraid, to my colleagues who are demoralized, to my colleagues who feel defeated by the intrusion of big healthcare systems into their practice of medicine, the intrusion of venture capitalists into our field of medicine, owning clinics and hospitals. Don't despair. Stand tall. We are physicians, and we were there at the birth of this republic. So we tell the government, we are here. We're part of the government that monitors our practice of medicine, intrudes into our practice of medicine, and surveil us. Government, take notice. We are descendants of the Rushes, the Bartletts, the Halls, Wilcots. We were the signers of the Declaration of Independence. And to our founders who signed with trembling hands and steady hearts, we remember you. We're going to continue your legacy. In the future episodes, I'm going to talk to you about my journey in medicine and psychiatry, developments in treatment modalities, how we hope to remedy the state of medicated America, where 1 out of 4 individuals is taking some sort of a psychotropic medication, how we bring other treatment modalities to remedy and help our patients. This podcast is also to the next generation of physicians. I tell you, rise and understand. We are at a junction in history that is very critical. If physicians don't take their place in the treatment of individuals who have psychiatric illness, in medical problems, if we let intrusion into our field from the government, from venture capitalists, from pharma. History will not judge us kindly. So to the next generation of physicians, rise. This is why I'm being unmuted. And I'm going to tell you the diary of the virtual psychiatrist. We as physicians that started this country, we are coming back. We are coming back to bring you stories about resilience, stories about the treatment of psychiatric illness, is about innovation, stories about new treatment modalities, psychedelics, artificial intelligence, transcranial magnetic stimulation, biofeedback. We're going to be able to help humans who are experiencing psychiatric distress for the future. This is why I'm recording this podcast, to be a testament that physicians in this country are coming back, because we know that a lot is counting on us and that our fellow citizens are counting on us to be able to provide them with treatment, to be able to comfort their depression and anxiety, and to be able to be there when this nation is ready for a rebirth. We're coming back. I'm unmuted. I'm going to tell you the diaries of the virtual psychiatrist. I'm your host, Dr. Mohammed Aly Rifai. I'm a professor of medicine psychiatry. And in the next episodes, you're going to be hearing interesting stories about the practice of medicine and psychiatry, innovation, intrigue, legal involvement, stories about SWAT teams. Please join me in the next episode to hear about new treatment modalities. Thank you.